Hi, I'm Dr. Kevin Haney.
And I'm Alex Beaumont, Clinic Coordinator of the Edge at Pinnacle Point. At the Edge, we cater individualized care plans to suit our patients' needs and help them feel better.
We believe that our approach to hormone replacement therapy is innovative, efficient, and effective. Here is some more information about men's health issues.
Hi, my name is Alex Beaumont, and I am the Clinic Coordinator of the Edge at Pinnacle Point. And today we're going to talk about peptides. What peptides do is they help your body just kind of ramp up its natural production of growth hormone and by raising your IGF-1 levels. So how I like to explain it is it kind of piggybacks on the effects of the TRT, and that over time you will experience increased protein synthesis, which translates to increased lean muscle definition, a greater state of lipolysis, especially in this kind of visceral kind of midsection where a lot of people come in and they're just kind of stuck with this thing that they can't get rid of. One of the more immediate effects that you would experience under our peptides is an improvement to sleep quality. So what the peptides do is they increase the induction of your delta wave sleep patterns, which is that really nice, deep restorative sleep that you hit when you're having all these deep, vivid psychedelic dreams. And typically the wee hours of the early morning or late night when our testosterone levels and growth hormone levels are at their highest. So our peptides are a minor subcutaneous injection that you typically take 4 to 5 days a week. And when you compare it to something like HGH or human growth hormone, which if not done correctly can be very dangerous and can really implicate a lot of dangerous long-term health defects on you, it is much safer. The peptides, they have a relatively short half-life and cycle. And since you're only using them for 3 or 4 or 5 days a week, you are having this cycle within a cycle where you're allowing your levels, namely your growth hormone and your IGF-1 levels, to kind of just recede naturally, thereby eliminating some of these really dangerous health effects that you can develop if you start abusing HGH. If you have any other questions or you're curious about peptides or anything else that I could answer regarding them, please feel free to call the Edge.